All right, gender-affirming surgery, GAS, we're going to be doing body feminization, which includes liposuction, full body lipo, expansion of the hips, buttock. Really, the crux of this is the waist to hip ratio. Do our body feminization, which includes expansion of the hips. We're going to really improve the waist by both liposuctioning and rib remodeling. And we're going to do some additional liposuction of the arms and neck. All right, halfway point, you could see nice improvement in the hourglass silhouette. When she heals up, this will come in further around there. So you can see pre-lipo rib, post-lipo rib. You can see how that nice curve comes in from the lipo with rib remodeling. Gender-affirming surgery, we're going to lipo the whole trunk. We got to create, she has a slight D shape, so I have to contour the hip roll a little more. Subtlety, really bring in the waist, rib remodel, and expand as much as I can in the buttock and thighs.
Before doing any rib procedure, we always get a CT scan. So this is a CT scan with 3D reconstructions. We count how many ribs there are. There's 12 ribs. One of our patients had 11. Then we measure out kind of where the angulation starts to really bend on the rib. So somewhere around here is the angulation, and we measure it out. It's about 8 to 10 centimeters. So this is around 8, this is around 10. And this is something, so when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows, the angulation right here to bring in is what allows the waistline to narrow. That angulation is maintained by wearing the corset.
Did our lipo with rib remodeling. Ribs really overcome the limitations of lipo. There's only so much you can thin out the waist, which is based on a pinch thickness. So the pinch is about 1/4 of an inch, 1.5 centimeters, and the ribs really bring in the waist further. So you can see there's a nice improvement in the waist to hip ratio. Gender-affirming surgery, you can see great improvement in the waist to hip ratio. The waist has been brought in by a combination of lipo. You can see how thin we went, both lipo and rib remodeling. That's what really creates that hourglass silhouette. Gender-affirming surgery, full body lipo, body feminization with expansion of hips, rib remodeling, about 2.5 hours. general anesthesia, off of work 2 to 3 weeks. Buttock will stabilize in volume in about a month. Rib results usually occur to 4 to 6 weeks, but the corset is necessary for 3 months. Final result usually surgically is 3 to 4 months for body contouring.
Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.